Cast is now starting. All attendees are in listen-only mode.
Hello? Hello? You can hear it? Hello? Hello? Hi everyone, welcome to the webinar Wednesday. I'm your host Nimish, and of course want to thank you for joining us. Today we're going to be talking about heart health and really how to keep your heart healthy and all the things that are involved with that. A little bit of information about today's speaker. We have Dr. Stephanie Campbell. She practices at our Pearland Clinic. She's board certified in internal medicine, and she attended medical school and completed residency at Indiana University. She joined Kelsey-Seybold a few years ago, and she is excited to talk to you today about heart health. So with that, I'm going to turn it over to her. Just a reminder, we will be taking questions at the end of the presentation, but if you do have a question that comes up, you're welcome to type it in the question box, and we'll try to get to it as soon as we can. So with that, I'll hand it over to Dr. Campbell.
Hi, everybody. I'm assuming if you're listening to this, you have a heart, which is good because that's what we're going to talk about today, and we're going to talk about how to keep it healthy. So first, the picture shows what a heart looks like. It's a lot more complicated than we think, and it doesn't look at all like those pretty hearts you see on the Valentine's cards. There are four main chambers of the heart. We tend to isolate them into the left or the right. The right pumps to the lungs, the left pumps to the rest of the body, and so that's why the left tends to be a little bit bigger. And when people are referencing heart function or areas of heart attack, they're usually actually referencing the left side of the heart because, like I said, that's the bigger side. It's the more active and the more important side. The lungs are pretty easy to pump to, so you don't have to really work that hard to do it. So just like everything else, the hearts for men and women are different. You know, Venus and Mars very differently. The average man's heart weighs about 10 ounces and a woman's weighs about 8 ounces. And so when you think about the size of the heart, you can actually just push your fist over your chest. Your heart is about the size of your fist. So it's really not as big as most people think it is. Women's hearts make up for their smaller size by beating a little bit faster, just like hummingbirds. So a man tends to rest his heart rate in the 70s. Women are closer to the 80s, so about 78 would be the average. So that's the average rate. And so how fast should you normally beat? Well, right about that, 70 for a man, 78 for a woman. And if your heart rate is faster, it's because the heart is having to work harder to pump the blood. So that means you're either exercising, so you're requiring more blood, or you're requiring more oxygen to the tissues, or you're not very efficient at getting it to where it needs to be, or it's pushing against higher blood pressure or something else that's causing resistance. The SA node, which is command central of the heart, that's where all of the electrical activity begins, and this is what's responsible for determining the heart rate. And so as you can imagine, it's responsive to lots of different things. It's responsive to stress, it's responsive to hormones, it's responsive to activity, so that's how it adjusts the heart rate. So heart disease. This is a pretty broad term. It's just a generic term basically for anything that affects the heart. And so it doesn't have to be just a heart attack. It can also be heart failure. It can be arrhythmias. So lots of different things can affect the heart and cause issues. Heart disease is the leading cause of death for both men and women in the U.S. right now. Most forms are preventable and easily treated. We just have to be able to diagnose them early, and so that's where screening comes into place. And also take care of the heart, because if most of the things that lead to heart disease are normal compensatory mechanisms developed by the heart in order to keep up, that eventually end up causing issues on its own or failing. So like I said, it is the leading global cause of deaths. 17.3 million deaths per year for cardiovascular disease. And again, remember, cardiovascular disease is just that generic term. It doesn't necessarily mean heart attack. It also means heart failure, arrhythmias, anything that causes the heart to not function as efficiently as it should be. So how do we prevent heart disease? How do we keep our heart healthy? Well, it's going to be the regular stuff that you guys hear all the time, right? Exercise, diet, rest, no smoking. The other one that tends to surprise people is don't stress, and that's easier said than done, but high levels of stress can be bad for the heart. It leads to a lot of changes down the road that can cause issues. And visiting with your doctor. This is where we screen you. This is where we listen, we check your blood pressure, we make sure your cholesterol is at a decent level. So this way we know where to focus any further prevention if we need to. Exercise, to me, is probably exercise and diet, the two most important. So regular exercise is the most important key to the heart health. And that's just because if you think about the heart as a machine, or think about the body as a machine, the more efficient it is, the better it's going to be, and the less work it has to do, right? So the more clogged the pipes are in the engine, the harder that engine has to work, the sooner it's going to burn out or give you problems. It's the same thing with the heart. So if you exercise the heart, it will make subtle changes in order to be more efficient. So that means it doesn't have to work as hard in order to be effective, and so it can conserve energy. The things that directly strengthen the heart are the cardiovascular exercise, and you can get cardiovascular response with just weight training or strength training. You know, if you do a whole bunch of squats in a row, you're going to notice that your heart rate goes up and you're a little breathless. That does mean you're getting a cardiovascular effect, because that heart has to pump the blood into those bigger muscles. Aerobic workout is when you're doing endurance training and you're doing mainly cardiovascular training and not strength training. So this is things like jogging, running, walking, biking, anything that's going to take you a little bit longer of time, and you're going to keep your heart rate up into your target heart rate for a little bit longer. 30 minutes, at least 3 times a week. And that is the bare minimum. So we'll move on. We've got your blood pumping. So next we want to make sure that we are delivering good nutrients. So because your heart is a muscle just like anything else in your body. And so it relies on those nutrients in order to maintain health. We also want to make sure that we keep those arteries nice and clean, decrease resistance. We don't want to have to pump hard. So we always want to make sure that we're eating as clean as possible. And what I mean by that is low preservatives, low sugars, and low salt. So sugar and salt is a preservative. If you think about how we preserved our foods before we had refrigeration, it was with sugar and salt. We salted our meat and we made candies and jams and things like that. The sugar is a preservative. And so in general, if you just think about lower preservatives, you will really tend to stay away from the things that are going to be harder on your blood vessels and your heart. The other thing you have to think about is the type of preservative. So the high fructose corn syrup, the monosodium glutamates, those are man-made sugars and salts, respectively. And those things are a lot harder on the body than just the natural, say, granulated sugar or iodinized salt. So if you're going to choose one, you want to choose the lesser of the two evils. But in general, if you eat fresh fruits, fresh vegetables, and lean meats, then you're going to be on a very good diet plan for your heart. And rest. This one is the one that always surprises me, right? People who sleep less than 6 hours a night are have 2 times the risk of developing heart disease than those that get 7 to 8 hours. And to me, 7 to 8 hours is a luxury, but I try to remind my children that I need to sleep longer because it's good for my heart. And maybe you can do the same thing. But again, this goes back to the efficiency and the taxing of the normal body. So if you're tired, if you're not getting enough rest, then you're going to have to work harder during the day. Also, if you're not giving your heart that downtime, because naturally when we sleep and we rest, the heart rate drops, the blood pressure drops, everything doesn't work quite as hard. It's like our own little mini hibernation. Then it has that chance to recover. So if you don't give your heart, the muscle, a chance to recover, then again, you're going to start making changes that can eventually cause problems. And stress. We always tend to throw stress out there as a problem, right? Oh, I'm having chest pain because it's related to stress, or I'm having palpitations because it's related to stress. And it's kind of a throwaway term, but it's actually very serious. And stress causes a lot of things to change in the body. So we increase our cortisol, we increase our epinephrine, our norepinephrine, so those are our natural adrenalines. We stimulate the sympathetic nervous system, which is the fight or flight response. And so everything goes into kind of hard-working mode. It's like telling your body that we're running from a bear, because the body doesn't know the difference between work deadlines or stress at home versus just I need to survive. And so those things, if you bathe your body in those hormones consistently, time after time after time, you will start to make changes. And there's actually a disease that's called broken heart syndrome, where people will go through a pretty severe stressful time and the heart will dilate and fail. And that's they believe it's from too much of the epinephrine and the norepinephrine. So imagine if you were doing that every day and then not sleeping, and then not exercising to help it be more efficient. So when you were stressed, it didn't have to work 3 times as hard, and not eating well. As you can imagine, it would lead to a lot of problems, which is probably why it's the number one leading cause of death in the U.S. And smoking. I feel like they've done a pretty good job campaigning about smoking and trying to get people off of this. But it does all by itself, even if you exercised every day and ate clean and got plenty of sleep and had no stress in your life, if you were smoking, you increase your risk of heart disease pretty significantly still. And they've also shown that secondhand smoke can be almost just as detrimental. And so stay away from people that smoke if you are not a smoker. And also, if you are currently smoking, it's never too late to quit. You can regain that lung function, and you can start to clear out some of those toxins within 6 weeks of stopping smoking. And as I said earlier, visit with your doctor. This is where we can help with those preventative type things. We can do screening, so if we need to do any further targeted counseling or therapy, we can. We're going to check your blood pressure. We're going to let you know how your weight is. We can also check your cholesterol and your sugar. Make sure that there aren't any other things that are coming into play that are eventually going to cause further problems for you. And we want to catch them as early as we can, because it's easier to make changes when you're on the front end than it is to try and make changes when you're on the back end already dealing with some of the consequences of having these issues. So just a brief recap on what you can do. We want to be physically active. We want to do some sort of cardiovascular training, 30 minutes at least 3 times a week. We want to choose good nutrition. We want to put good, clean things into our body. So we want to do lots of fruits and vegetables, lean meat, stay away from anything that's processed in a can, a jar, a box, or coming from a restaurant as much as possible. And we want to avoid tobacco. And we also want to try to manage our stress, and get plenty of sleep. So 7 to 8 hours. Plenty of sleep to me would be like 12. I wish I could get 12. But if you can get 7 to 8 hours, that's great. And then, managing stress, that comes with things like deep breathing exercises, meditation, taking at least 5 to 10 minutes a day just to turn off that sympathetic nervous system so that you can at least reset and start over. I think that leaves us for time for some questions.
So if you haven't already, go ahead and fill your questions in the question box, and we will try to get to it as we can. We still have some time in the presentation, and this, heart health is such a complex topic, so we are definitely looking forward to answering some questions.
All right, so far we've got some really great questions coming in here. The first one I'm going to go through is, how does alcohol affect your heart? And that's actually a very complex question. And so in general, we tell people to stick to the World Health Organization recommendations for the amount of alcohol, which would be 2 to 3 drinks weekly for women and 3 to 4 for men. And that's per week, and you can't bank them either. So you can't say, okay, Sunday I'm going to have my 4 drinks. And that's just because we know at excessive or even moderate amounts of alcohol, it can be toxic towards the heart. So alcohol in itself is toxic toward muscles. And so the heart is a muscle. It can cause heart failure, cardiomyopathy, and it's also toxic for the liver, which can subsequently lead to other heart issues. Okay, the next one that has come up here is the difference between HDL and LDL cholesterol, and that's another good question. So when you go to your doctor and you get a lipid panel, you get a few different numbers. You get the total cholesterol, you get the triglycerides, which is essentially the pure fat in your blood. So if I went out and had a hamburger and measured my triglycerides, it'd be off the chart. And then you also get the LDL, which we tend to think of as the bad cholesterol, and the HDL, which we tend to think of as the good cholesterol. And basically the difference between is the density. And so that's what it is. High density HDL, lipids and low density. And so low density tends to be more sticky, right? So they're not all together, so they can stick other places. And those are the ones that tend to stick to the walls of the arteries, and they tend to be a little more volatile, so they can break off and move places and cause inflammation. So we want you to have more HDL, and you can raise that with exercise. And yes, there was my plug again for exercise. There's a couple questions in here in regards to some supplements for heart health. So omega-3 fatty acids are great for heart health. Usually the problem people have with those is the dose. So in order to really get a good effect, you have to take 1 gram 3 times a day. And sometimes people have a hard time tolerating that. It can upset their stomach, or they say their burps stink. But in general, the omega-3 fatty acids have been shown to decrease morbidity associated with lots of things, not just cardiovascular issues. Garlic supplements I have not seen very good evidence for, but there's not a lot of evidence saying that they're bad for you either. And so if you take garlic and you feel better, then I think that's good, but I would not recommend it as a first-line therapy if you are having issues with lipids or heart disease. All right, kind of staying within the supplement or other things that you can do, there's a question about the keto diet for heart health. So my thoughts on the keto diet are that as long as we do it together and we talk about how you're going to do it and whether or not you have any other medical conditions we need to keep an eye on, that it can be very effective for weight loss. And it can also help lower sugar, so it can increase your insulin sensitivity. So those things in general are good for heart health. I don't typically recommend a keto diet just for heart health, but I will recommend it, or I will do it with patients if I'm trying to help them get their sugars under control and help them lose weight so that we can maintain better heart health. Another question that we had is about the calcium scan. So the calcium scans will scan the arteries in your heart, and they determine the amount of calcifications in the arteries and give you a score based off of that. And so what we do with that score is we then kind of give you a risk assessment. So if your score is very high, then you are at a high risk of having a heart attack or other issues in the future. And so that makes us tend to be a little bit more aggressive about preventative measures or medicines in order to help bring that back down. So it basically will help you assess your risk. It doesn't tell you whether or not you're having an active problem. So another question is there a specific test to ask for during an annual exam that focuses on clogged arteries? And it's not specifically for clogged arteries, but there are things that will tell us if you're more likely to have clogged arteries. And so that's going to be your lipid profile. We talked about HDL versus LDL earlier. We talked about blood pressure, and then also checking sugar. And so everything tends to kind of run hand in hand. And so if you have one of those, you're at a higher risk for clogged arteries. If you have more than one or three or even more on that, then your risk is even higher. Now, if you want to look for specific clogged arteries, we can do carotid ultrasound. That will show us sometimes if things are clogged, and we will do that based off of your risk factors and things going on. And then the calcium score that I talked about a little bit earlier, that will show if there's a lot of plaque buildup in your arteries. And so if we're very concerned, then we can always ask for one of those. The next thing somebody asked is if there's a role menopause will play in heart disease. And yes, absolutely. And we do think that that's maybe why women are at a higher risk for heart disease and why the risk changes with age. So we do know that women have a higher risk for heart disease as they age, and that is most likely due to going through menopause. Menopause does change a lot of things. It changes your lipid profile. It changes blood pressure. It changes other hormones effect on heart disease. And so that's another reason that we really want to start screening people, and we want to make sure that we're actually going into menopause as healthy as we can be, so that if there are some minor changes, they're not as detrimental.
Okay, we'll probably get to one or two more questions. So if you haven't had a chance to type in your question, definitely do that, and we'll do our best to get to it.
Somebody is asking about blood pressure, and so we always talk about high blood pressure, and someone wants to know if there's a concern if it's too low. So in general, I don't worry about low blood pressure unless it's causing symptoms. So if you're passing out, if you're dizzy all the time, if you're having a hard time exercising because you always feel lightheaded, then we do worry about that. But otherwise, if the blood pressure is low and you're feeling great, that's actually a pretty good indication that you're efficient at what you're doing. And so your heart is not having to beat as hard, and it's probably not having to beat as often. So that means every time it pumps, it does a really good job, so it doesn't have to keep doing it over and over again.
Let's see, is there anything else? I guess because avocados have Okay, so we'll answer our last question here.
All right, going back to those omega-3s that everybody loves and wants to take, somebody wants to know if you can eat an avocado a day instead of taking the pills. And in general, I do think if you get your vitamins and your minerals and your omega-3s from your fruits and vegetables instead of taking it in this little pill that we've kind of man-made and packaged really pretty, then your body knows how to process it better and knows how to use it better. And so you probably don't need to take as much. So that's why you have to take 1 gram 3 times a day of the pills, but you could get away with doing an avocado a day and get a pretty good dose of the healthy fatty acids.
Okay, well, that wraps it up for this presentation. We want to thank everyone for attending and want to thank Dr. Campbell for presenting her insight on this topic and going through all of your questions. Just want to make a quick reminder for next month's webinar. It's going to be on the first Wednesday of March, and we're going to cover preventing sports injuries and how to have good body mechanics really in your daily life. So it should be an interesting topic, and we hope to see you then.